Welcome back to DotLife. We are talking about neighborhood healthcare today with a specific focus on the closure of Carney Hospital. And to that end, I'm joined by Dr. Bisola Ojikutu, who is the Commissioner of Public Health for the City of Boston. Thank you so much for joining, Dr. Ojikutu.
Thank you for having me.
And we're also joined by Michael Curry, who is President and CEO of the Massachusetts League of Community Health Center. Thank you for joining, Michael.
Glad to be here.
And both of you are co-chairs of the Dorchester Health Planning Working Group. So it's great to have your perspective on specifically what's happening with Carney. And I want to start with the Carney conversation. Dr. Ojikutu, let's start with you. What's the situation down at the former Carney site right now?
So the hospital closed on August 31st of last year, and just taking a step back, because I think it's important to put this closure in the context of what happened more broadly, nationwide with the Steward healthcare system. It was, last year and for years, it's been the largest private for-profit hospital network in our country. And hospitals like Carney, for-profit hospitals, were often hospitals that were designed to care for people who are lower income. They're safety net hospitals. And unfortunately, because of the bankruptcy situation that occurred last year, Carney ended up closing. And, since those doors were closed, our Mayor Michelle Wu, and Governor Maura Healey said, well, we can't just, let this happen and not have some next steps and not have a plan and a way forward. So they brought together a working group to essentially identify, the unmet needs in light of the closure, but also bigger and broader. What are the unmet needs of Dorchester and the surrounding catchment? What are the things that the people in Dorchester who used to rely on Carney are missing now? And let's figure out a way forward. Let's figure out how to promote health equity, how to make sure people have access to care as well as other social determinants post-hospital closure. Bring them together. And we did so. Michael and I co-chaired over the course of 5 months. We had a total of 9 meetings, but lots of other, one-on-one engagements, lots of outreach to community. And we sat down with experts in the field locally, our hospital leaders, union representatives, folks who used to work at Carney Hospital. But I think the important piece, though, is that we brought together a lot of community members. We brought together a lot of people from Dorchester and from areas of Mattapan who previously received their care to really find out, what are they feeling now? What are they missing? What are they worried about? And then what do we do about it? And so we pulled that data together and created a report, a list of recommendations, things that we need to work on, things that we need to move forward. And that was released last week, and we're looking forward to the future. One thing I do want to say is that, when we started this process, I felt, and maybe Michael, you would feel this way too, but there was sort of a sense of sadness and anger, closure of this major health resource in a neighborhood that obviously needs healthcare services, but more than just, the actual healthcare, but, social determinants of health and all those other needs that for many people were missing. But by the end of this process, really looking at the unmet needs, talking to community members, thinking about, what, we could do better than this in the future. We can envision a better future for health and well-being for our communities. And I think that's what we're trying to do. So it was actually, we're still angry, but we're less sad. I think we're hopeful about the future. At least that's the way I feel.
There's a direction to move forward toward, which
Yes, that's
gives
right.
us something to be less angry about.
Mhm.
Can you talk about what I know that the report really heavily focuses on maintaining that healthcare component, although it will likely be a mixed-use site.
Mhm.
Do
Mhm.
you think it will be a full-fledged hospital facility?
So I think that there are a number of challenges given what we know about our current context. I mean, certainly we put together some recommendations that focus in on the actual site use. We focus in on emergency services, which are now missing from that area, primary care coordination, behavioral health, as well as, health-related social needs. And we made pretty comprehensive recommendations about each one of those. But I think the challenge is that it's one thing to make recommendations and another thing to make them reality. I mean, there are financial pressures, right? And, we're in a federal context that I think is going to be very difficult to move things forward in. Not to say that I'm not hopeful, but very difficult. I think that we're also dealing with a situation where we don't own the land. and I think that's a big piece of the problem here. And we've been talking to the landowners, and they have been involved in discussions with us, and I'm hopeful about those discussions. And we don't quite have, the situation clear in terms of who the operator of healthcare services on the site would be. But again, it's not that there wouldn't be interest, given we have recommendations and we have momentum. But I think that all these things need to be sorted out. So there's a process going forward that I think is important for us not to say, okay, here's some recommendations, let's post the recommendations and let's move on. We've got a lot of work to do to make this a reality.
And on that front, what is the timeline looking like at this point?
So what I would say is that I can't give you like months or a date when we will have a final sort of solution. I think that this, as I said, is ongoing. We are continuing to speak with working group members. We're continuing to talk internally about the way forward with, or like BPDA and other folks, other health departments, and certainly with the mayor, and the governor has copies of these working group recommendations. And I think the key piece is working very directly and very closely with the owners. And we are in some, what I hope are going to continue to be collaborative discussions with them. Because once we come to a point where we can agree on something, I think that's when we can sort of move forward. But again, I want to sort of leave listeners with a sense of some hope. We have challenges, but this process, I think, felt like an opportunity to carve out a way forward that was better than what was actually existing when Carney existed as an acute care hospital.
Yeah, that's really an exciting prospect. I'm sure you've heard feedback on the plan or on the report. Is there anything that constituents can do to give their opinions or to give any feedback?
So I think it's interesting. One of the most important pieces of the recommendations, it was community input.
Yeah.
Healthcare for All actually was able to do door knocking and do, listening sessions with, it was actually 40,000 doors that were knocked. It's like, it was a lot of people. And in
Wow.
addition, we had, our community health needs assessment was in the field at the time. It was like 480 responses from the catchment area, as well as we had, public listening sessions. We really tried to incorporate as many people as possible. And I think that going forward, we can't just let this go. I've seen this many times, in our world where there's an issue, there's momentum, it's in the media, but then it just sort of doesn't go anywhere.
We have short attention spans these days.
Right. People move on to the next
Right.
thing. They're all their challenges, and I think obviously people sort of realize that, there are fiscal challenges. We got a federal context that's very adversarial right now. And you're right. People either give up or they say, let's just move on to the next thing that may seem more tangible. I would say that the best strategy is for people to remain vocal about it. I really appreciate the Dorchester Reporter and Bill Forey writing about this and staying consistent with his, dissemination of information to the public. And I think we need to continue to talk about it. We can't just move on to the next thing, the next issue. And even though these, the challenges that I described, not owning the site, not having an operator, the fiscal piece of this, these are daunting challenges, but it's not as though it's something we cannot overcome if we stay focused and if we work together and if we think in a creative, innovative way.
Mhm.
I don't want it to be 10 years from now. I'm a Dorchester resident, so I'm 5 minutes from Carney Hospital. I don't want to be walking down that street and see the same thing. And I don't think I'm going to be.
An empty, overgrown. Yeah.
That's right.
Yeah, absolutely.
It's from my perspective, that would be the failure.
Yeah.
And I don't actually think we're going to fail. So
That's great. That's great. I want to shift a little bit to Michael. In the absence of the Carney right now, what other facilities are there in the Dorchester Mattapan area that folks should be thinking about or going to when they have issues?
So one, good to be here with you, and it's good to be with the Commissioner, following up on this critically important work of looking at reimagining what could be on that site where once Carney Hospital stood. I want to lift up first that I think, the Commissioner talked to this, but I want to talk about how important it was that that group had a, diverse set of thoughts and ideas, perspectives, experiences with Dorchester. So hospitals, community health center representatives. I had a few of my members present, Guale Valdez, Mattapan Community Health Center, Dr. Vora at Dot House Health Center, Dr. Guy Fish representing Cobman Square, all bringing their lived experience, but also their professional experience and training to this conversation around what to do. You had nurses and public health officials, emergency service providers, labor leaders, community leaders, elected and non-elected officials on the state and federal level and municipal level. So one is I just want to lift up that this conversation was very inclusive, in addition to what the commissioner said in terms of engaging community in community to get their feedback. I think that there's an interesting challenge. This Carney closure couldn't have come at a worse time. Our healthcare system, our health system is in crisis even before the closure. Hospital finances, health center finances, nursing homes, the affordability of healthcare, all those things are stuck. People being stuck in the wrong places to get care were all prevalent before we were dealing with Carney. Carney just made it worse. So I think that health centers are seeing it from their vantage point, which is long wait times, even to see a primary care provider, which is in no one's best interest if someone can't get in for a well visit, for a preventive care visit, or to get that pain that they have addressed, mental health, their eyes, their teeth, or their overall physical health. That is a problem for all of us. And unfortunately, that's the system we're dealing with now. The Carney closure creates another element of people coming in who are displaced from their care setting and are now coming in. And unfortunately, as the commissioner would say, we want people in the right place at the right time, getting the right care. So if you belong in an emergency room, we do not want you at a community health center. We want you at an emergency room that has the appropriate level of care for you. But if you need primary care, if you need urgent care, if you need the many services that community health centers provide, not only do we want to see you, both Carney former patients and other, but we also want to make sure that there's an investment in expanding access to those services in community. And the commissioner and the members of the working group all echoed that throughout the process.
Yeah, I mean, to your point, those minor seeming ailments become emergencies if they aren't addressed. So that becomes a greater burden on the entire system.
Yeah, and I'll lift it up. The commissioner's heard me say this 1,000 times, but I love the phrase "pay now or pay greater later," right? So for individual, pay now means we need to make sure that person gets the right care that they need when they need it. So that I use the example, stage 1 is stage 4 cancer. So we need you to come in, right? Again, eyes, teeth, or your overall physical health. And then 2, if Erin ends up in the emergency room, the highest cost setting when you could have been in a primary care setting, that's not in our collective best interest either. We're going to pay greater later. We need to think differently and smart. And I love being a part of this group, reimagining what care in Dorchester could look like.
When you look at a map right now of the major health centers in Boston, it's pretty clustered north, a little bit to the west. There's a big empty spot now down in what I think are the most underserved areas anyway of Boston. So Mattapan, Roxbury, Dorchester have the worst health outcomes in the city as it stands. So that's obviously a problem. What is the importance of having those localized? I mean, will people go to MGH? Will they go to Dana-Farber? How comfortable will they feel? And will they even physically be able to get to those facilities? So how important are those neighborhood facilities?
Yeah, I think it'd be struggle for me to answer this question without giving you a little bit of history. So one is and Jack Geiger, who was one of the founders of the health center movement, saw this model of community health in South Africa. He was so overwhelmed with this notion that they had essentially community health workers before we knew the term, going out into villages and communities in South Africa, getting people to come in for care and advising them on giving birth and other services that they needed. We understood that getting them to come into a community-based setting where people spoke their language, understood their culture, maybe shared their lived experience, meant that they would have better health outcomes. That's true when it was in 1960, late 1950s, 1960s, when Jack Geiger was in South Africa, or when he launched this movement in Dorchester. at a health center in Dorchester. So we know what works. I think when you mentioned the health centers in Boston, there are 20 health centers. They serve one out of every two people in the city of Boston. But you're right, there are pockets, even in the city of Boston, where people have to travel farther. What we need to do is, one, message community and make sure people know where the access points are, what the wait times look like. We need to make sure that people understand that it is not acceptable not to get care. We don't need you to endure your pain. We need you to get treated for whatever your condition is. And then we need to make sure that the access points exist. And whether that's expanding some operations, urgent care sites, Cobham Square, Dot House, Mattapan are just three examples, or even a little bit further away, South Boston. There are other health centers in and around the community that serve Dorchester that could step in and provide additional support. But we need to solve, I think, again, to Dr. Ojikutu's point, this report lifts up all the things that we need to be thinking about around behavioral health, primary care coordination, health-related social needs. This report was pretty comprehensive, and I'm looking forward to it manifesting in a new version of Carney Hospital that meets the needs of Dorchester.
This question, I think, is for both of you. So right now, how would you recommend folks find the resources they need to determine where they should go for what care they need today? And how can they stay abreast of what's available at the Carney site as things continue to develop there?
So I'll jump in, but if I could just say one thing before we get started, just because on that particular question, just because, we talk about sending people to other places to get care. I want us to be very clear, though, that there are still unmet needs, even when people go to those other places or look for those other places. The reality is that our health ecosystem in even a place like Boston, which is so resource rich, has holes in it,
Pre-Carney closing.
Yes,
Yeah.
well, Carney closing, like Michael stated very clearly, that it created worsening of a problem. Right. It didn't start the problem. If you look at, just take, for example, behavioral health needs, mental health needs, we do not have culturally, linguistically appropriate providers all over our city, and therefore
I think you're inviting a whole new podcast here.
Right, and I think this is what they need to understand, need to hear, that we have work to do. People can't just say, oh, I'm going to drive 30 minutes further and I will find that right provider who will do what's best for me. And I think people need to understand that in many ways, we do just need to envision a new way forward in how we are providing care, and we need to be strategic. And one of the things that with this working group that I really appreciate is that we sat down and we looked at data. We looked at the behavioral health services, community behavioral health centers, and we saw, well, there was already a gap, even when Carney was there. Absolutely. So these are problems that have been long standing. And I was so happy, like Michael said, to have this broad array of experts in the room to say, we need to think differently. We need to do better. And that's why, I would say that I feel somewhat hopeful, because just the fact that we were in this room, I don't know that process has occurred in that same way before. So
this is almost a catalyst to address much larger, more pervasive health system.
That's right. That's right. I mean, we talk about a healthcare system. We don't have a system. We don't have an integrated system where everybody gets exactly what they need. Instead, we have a patchwork in some ways. So you said where people should call. I'm not sure that we have sort of a one-stop shop where people can call. But what I would say is that if you are in Boston, you're a Boston resident, you can call our mayor's health line, which is staffed with linguistically diverse individuals, and it is available Monday through Friday, 617-534-5050. Now, we do a lot of work with health insurance, certainly, but we can also tell people where to go. Where's your nearest community health center, which are a wonderful resource. And here's the telephone number. Do you want us to help you get there? Do you want us to call for you? So this is a resource. I think sometimes it's underutilized, unfortunately, but 617-534-5050. I think the other piece that we've been talking about at the Boston Public Health Commission, we've been talking to some of our community health center partners about this, is really doing more to educate people of when to go where. What are the circumstances in which you should be BMC's emergency room, or you should be instead at Codman Square's urgent care center, or you should just wait your wait time to get to a primary care provider. So I think we need to do better on that, and we are working in that direction. But so this is what we can currently offer.
I mean, those are tough questions to answer for anybody. I don't know. Is this a thing? Should I be going somewhere to see somebody about this, or is this just
Mhm.
me, not getting enough sleep last night? So it's a tough,
Right.
that's a tough problem. At the risk of aging myself, there's a word from The Simpsons called crisitunity, which I think you're describing right now, that this is a crisis, but it's actually an opportunity. So.
I love that.
And love Crisitunity. Crisitunity, is that the right phrase?
Crisitunity.
Crisitunity. I love the phrase, but I do want to be clear.
Mhm.
The closure of Carney is a setback for patients who need access to care,
Yes.
right?
Yeah.
I want to be clear because the commissioner spoke to this. The federal policy shifts will have an impact that will exacerbate everything we just talked about on those poor communities, those communities that are disparately impacted by disease. So there's a lot going on.
Mhm.
There's an opportunity on the other side of it. I think that's the hopeful part that the commissioner and I have to find. We have to find space for hope.
Mhm.
And the hope is that when we come back, right, when there is a new placement of services at Carney Hospital, how can we do it better? When we come back from all the shifts in federal policy that will hurt people and patients, can we come back even better? We have to keep our eyes set on the long game, but in the short term, and I just don't want to give that, sort of a pass. Folks will have a longer time and a wait to get to care, and that has a real impact on individual health. But credit to this mayor and this governor who convened this group of people to think about what the present and what the future should look like.
Yeah. So short-term pain, hopefully leading to long-term better outcomes, but we'll keep our eyes on what's happening, and I'm sure we'll have conversations again soon. Last 30 seconds. Both of you, can you give me your favorite place to eat in Dorchester?
Am I first?
Lucy's for me. I love to watch the Celtics game at Lucy's, and the food is great, and the vibe is good, especially when the weather's good,
Windows are
and they
open.
open up the side windows.
I'm with you. Dr. Ojikutu.
I was gonna say Lucy's too, but I have an 8-year-old and she goes to music at the Boston School of Music, which is right next door to Pat's Pizza. And so she always goes in at least once a week for a slice. And the owners there have given her free slices because they see her so often. So yeah, I gotta give a shout out to Pat's Pizza.
That's great.
And I got to give a shout out to the owners of the mix too. So there's people of color who are owning establishments in Boston, and I just want to shout them out because a younger generation is taking advantage of these new opportunities, and want to say thank you to them as well.
Well, I want to say thank you to both of you. This is a great conversation and one that we'll have again. Thanks for taking the time to join. I know you're both very busy. Appreciate it.
Thank you.
Thank you. Anytime.
Thank you.